specifically laser surgery versus sort of the time-tested true version of a scalpel blade or a knife procedure. The laser is, in my opinion and an expert's opinion, better than a scalpel because it cauterizes the vessels so you get less bleeding, which makes the surgery procedure faster. The other things it does is it actually speeds up the healing process, and it also reduces inflammation, and inflammation is the key reason for pain post-surgically. Belly feels good. Now, regarding surgical procedures in general, these are procedures where an animal is going under general anesthesia. The animal should have a really good physical exam done prior to the anesthesia, several weeks before if possible, as well as some blood work done. This blood work helps us determine if there's any sort of liver or kidney or hidden abnormalities that may be important. You're then going to obviously want to do a physical exam the day of the surgery, listen to the heart, listen to the lungs, make sure everything sounds fine, and make sure that patient is stable as well. Once they're under anesthesia, what's going to happen is initially they're going to get an injection of a pain medication and sometimes a sedative, and that's just to kind of make them feel more comfortable. It's going to relax them a little bit and take away some of the pain that's going to be happening during the surgery and as they recover as well. So in the first surgery, we used a scalpel blade. Now, this is a cat rescue spay that we're using the scalpel blade for because there's financial issues. The laser surgery is a little more costly, so we stick with a scalpel blade. And as you'll see when I make the incision, there's a little more bleeding, and there's some little tiny skin bleeders, the redness that shows up, and those are simply little capillaries that are bleeding when I make this incision. After the surgery, there's going to be a little bit more puffiness and a little bit more inflammation. But otherwise, a scalpel blade is the same technique and the same incisions that you make with a laser. Now, in the next patient, we actually did use a surgical laser to make the incision and to make any sort of cuts, whether it was removing the uterus or making an incision into the abdomen. There's going to be a little bit of smoke and a vacuum used to remove that smoke so that the surgeon doesn't have to breathe it in. But otherwise, it's a very fast and in my opinion, a bit of a cleaner surgery. That's through the skin. Is this moistened? Now, during the surgery, you're going to want to monitor anesthetic depth as well. And there are different tools out there. The most important thing is just having a registered vet technician, which is kind of like a nurse for animals. And there's some sort of tools or machines that can help us as well. You're going to want to measure the blood pressure regularly, whether that's through what's called a Doppler or a PET map or a Cardell. And then also you're going to want to make sure that these animals are kept warm because you're going to be going into the abdomen, they're going to be getting some fluids that can cool their bodies off, so even just having a heating blanket underneath them can actually speed up recovery significantly. That's generally how surgery goes. You know, it's a pretty standard procedure at any veterinary clinic, but it's really important that you speak with your veterinarian and make sure that these high standards are utilized to keep the patient as safe as possible.